saying that you should all be taking vitamins. So just be mindful of that. And I'm happy to answer questions at the end. And I want to start by just telling you how I even got to this topic. So I was a brand new geriatrics fellow, and my mentor, Dr. Giselle Wolf-Klein, who you may have heard of, she said to me, well, what are you going to research? And so my first research project was focused on medications, especially in older adults. And it was mind-boggling to me, the amount of vitamins that people take and just how things are stopped and started very haphazardly. And so this is how this topic came to be. And I published an article on this in Clinical Geriatrics, and the rest is history. So why vitamins? So what's fact and what's fiction? And this is the focus of our talk. Anytime I turn on the news, I look on the internet, there's always something about vitamins, either that we should be taking them, that maybe we shouldn't, that we must be taking this, or, recently magnesium has made headlines, but also there's been constant recalls. Boots issued a recall for 31 brands of its vitamins. And so this is always in the headlines, and we're gonna try to make sense of it. Vitamins are extremely popular. So over half of all US adults take dietary supplements, and I'll show you that this is even higher in older adults, the patients that I take care of. So the vitamin industry is a multi-billion-dollar industry. In 2016, annual sales exceeded $122 billion, and this number just seems to go up. And this is all across the world. If you just think of Centrum, there is 11, 12, 13 types of Centrum alone for under 50, over 50, kids, pregnancy, women, anything you may want, heart health, vision health. And so what's the difference between all of these things? Sorry, one second. My slide doesn't want to advance. Hold on. Okay. Here we go. So the vitamin industry continues to grow, as we just discussed, and this is evidenced by just the vast number of stores. The GNC has over 7,000 stores in the United States. The Vitamin Shop sells over 20,000 different kinds of supplements. And who's buying these vitamins? Well, it seems to be the baby boomers. So in the Iowa Women's Health Study, which is something I'll be referring to shortly, 85% of women said they took at least one supplement. So you could see that this is extremely common. So what's the problem? Is there a problem? I mean, we should all just be taking vitamins. Well, the vitamin industry is not regulated by the FDA, the Food and Drug Administration. It's actually considered under the food umbrella. So again, why is that a problem? So in 1994, the Dietary Supplement Health and Education Act was passed, and this really created the modern framework for dietary supplements. So for any ingredient considered a dietary supplement that was sold before 1994, you could just sell it without showing that it worked or without showing that it was safe. Ingredients that were created after 1994, you just had to show a reasonable expectation of safety. So what does that mean? Any vitamin that's sold, any dietary supplement, nobody actually has to prove that it works or says what they say it does. All they have to do is prove that it's probably safe, okay? So what happens from 1994 to 2012, there were an increase in supplements from 4,000 to 55,000. Only 170 were actually reported to the FDA. And you started seeing a lot of these recalls. People actually died sometimes from taking some of these supplements, especially the ones that people were taking for sexual enhancement or for sleep. And so the FDA really has tried to come in and make some changes, but you can imagine with any industry that's $100 billion of annual sales a year, the lobbyists make a stop to that every time they try to introduce new regulation. And the other thing is, what's the role of dietary supplements in westernized societies where a lot of the food is fortified in industrial countries, different grains, the water is fortified. And so deficiencies are actually extremely rare in westernized societies. So is it just expensive urine, right? Okay, so we take vitamins because, well, they're not going to do any harm, and the least, and they may actually help. So we take them, and so the joke in this industry is that our urine is very expensive from all the stuff we take. But is there more to that? Could vitamins actually cause harm? So I'm going to ask you a question. Again, I don't want anybody, freaking out about this, but I'm going to just say, which of these dietary supplements have been associated with increased mortality or death? So I'm going to read these vitamins out loud, and you just think to yourself, has this been associated with increased death? So multivitamins, iron, folic acid, vitamin E, vitamin A, vitamin C. And I'm sure a lot of you all have taken these or are taking them. And the answer is yes to all of them. And I'm going to show you the studies that have come out. Before that, I briefly just want to talk about the history of vitamins, the epidemiology, meaning who actually takes them. I'm going to introduce some recent controversies and then draw some conclusions. So how did vitamins start? So in 1800 BC, the ancient Egyptians said, "A woman who sees not, thou shalt make her eat liver." And I don't know if any of you want to take a guess as to what vitamin they were referring to, but they were referring to vitamin A, right, and eyesight. And then during the Renaissance, when they used to go on long voyages, they figured out that when they ate citrus, it helped prevent scurvy, right? And of course, and scurvy is a bone disease. And of course, they were talking about vitamin C. Now let's give some definitions. So what is a vitamin? So vitamins are organic compounds required as vital nutrients in very tiny amounts by an organism. There are 13 vitamins. You could see A, the B's, C, D, E, and K. Minerals are chemical elements required again in very tiny amounts by living organisms, and that's the calcium, magnesium, potassium, just to name a few. And then we have supplements, dietary supplements. So what's the difference? So supplement is anything that contains a dietary ingredient intended to add further nutritional value, i.e. to supplement the diet. A dietary ingredient can be a vitamin, a mineral, a herb, a botanical substance, amino acids. So anything that's meant to supplement is under this umbrella. And this is the RDA, the recommended dietary allowance. And so the FDA publishes these recommendations. This is how much we should get of a certain vitamin, a certain mineral. And I just want to highlight this, this bell-shaped curve, right? So the RDA, the recommended dietary allowance, is the amount that's required for 95% of the population. And this is what you see on ingredient tags, right? So the amount you see there is good enough for 95% of the population, meaning probably most people need less. And when you see supplements that give over 100%, you're getting into this range. And what I like to highlight here is that, yes, there's risk of inadequacy when you go below this level, but there's also the effect of taking too much, and then you get the adverse events. So nothing's for free. So again, how often are these things taken? Well, 63% in an article from 2004, 73% of US adults were found to be taking them in 2008. So again, very, very high numbers. And who's taking these vitamins? Is it older people, younger people, men, women? And so definitely as people age, there's an increase in supplements. Women tend to take more than men. White race tends to take more than non-white. And actually, interestingly, the more educated someone is, the more likely they are to take vitamins. Okay, so now we've come to the controversy, right? So dietary supplements are extremely common in the United States. We're not really sure what the role is in supplementing in westernized societies. And now we're going to talk about some new studies that raise questions as to the safety. So this was a landmark article, and we call something landmark when really it has a big impact. And so this was the Iowa Women's Health Study. And it was an observational study where they followed 40,000 women over about 20 years. These were women in their 60s. And really the point of the study was to look at how dietary and lifestyle factors affect the incidence of cancer. But really what they came away with was these findings about vitamins, and that really drew the most focus. So again, so they followed these women for about 20 years. Some of them passed away, obviously, some of them didn't, and they collected all this information. And they looked at, again, who takes vitamins, and they found that the more education somebody has, the more likely they are to take vitamins, and the more they exercise is associated with having more vitamins. These were the vitamins that were most commonly taken: multivitamin, calcium, vitamin E, vitamin C, and vitamin D. And ta-da, this is what they found. So there was increased mortality or death associated with the use of multivitamins, iron, folic acid, vitamin B6, magnesium, zinc, and copper. Again, these are very, very small increases. So I don't want anybody to think that, this is a direct cause of death. And this is an observational study, which means this is not a randomized controlled trial, which is the highest level of evidence. And so you can't make causal conclusion. So you can't say that a multivitamin caused this person to pass away. These are associations. But again, something that we have to consider when we think about what we put in our body. So I want to spend a second on multivitamins because by far these are the most commonly used, especially in older adults, but really by kids and by all adults. And so I don't know if you guys have ever looked at what is in a multivitamin. You can see that there is about 30 different supplements. And I just want to point you to the percent daily value that these multivitamins have. And it ranges from 50 to 150% of what you actually need in a day. And even some of those things we talked about earlier, like copper, like iron, have pretty hefty amounts. And this doesn't include what you're getting from your diet, of course. And that's just the beginning. That's the multivitamin. But if you take specialized vitamins, like for example, there are eye vitamins, some of them have 1,333% of the daily required amount of vitamin. Even Centrum Silver has 167% of the daily requirement for vitamin E. Again, really insane amounts sometimes that you really have to look at what you're putting in your body before doing it. Iron I like to talk about because obviously, we get anemic and we take iron. Besides the fact that iron causes a lot of constipation, in this study, it was actually pretty strongly associated with increased mortality. Now, again, we can't rule out that sicker people didn't take more iron, right? But indeed, there is some concern here because iron can be an oxidative stressor, meaning, we think of antioxidants. So iron actually causes oxidation. And there's a lot of talk in the medical industry, in medicine right now about what's the optimal amount of hemoglobin or iron. And studies seem to indicate that sometimes, being on the normal low end is better than going up. And again, this is to the fact of more is not always better. So what conclusions can we draw from this study? Well, I think it highlights that, these supplements may not be, may cause some concern. We don't know for sure, but what it does mean is that it's probably not just expensive urine, that if we're going to take this, we need to have a good reason for it. Some of the limitations of the study, of course, are that it was observational. Like I said, it wasn't a randomized study where we blindly chose one person to take multivitamin and the other person to take placebo. That would be a causal study where we could say something caused something. But again, some concern. And since then, there have been a bunch more studies. The Annals of Internal Medicine is one of the most highly ranked medical journals. And they had a whole issue on this. Enough is enough. Stop wasting money on vitamins and dietary supplements. I'll show you the US Preventative Services Task Force has come out with numerous recommendations. Multivitamins and cognitive impairment, that didn't play out. Multivitamins and heart health has not played out as well. And again, just more and more evidence on multivitamins and the fact that they don't actually improve anything. Let's switch gears a little bit to antioxidants. So we think of antioxidants as anti-aging, anti-cancer, cardiovascular protection, and dementia care. Vitamin A we'll start with, and this is the retinoid family. And I'll start with an older study. This was in JAMA. Again, JAMA is probably the second highest ranked medical journal in medicine. And this was the Nurses' Health Study. They followed 72,000 postmenopausal women for about 18 years. And they looked to see what happened when people took vitamin A. And they found that vitamin A actually increases your risk of hip fracture by almost 50%. And it causes the bones to weaken. Vitamin A has also been associated with increase in lung cancer, especially for people who smoke. So if this was a Cochrane review, Cochrane reviews are the highest quality review articles where they take all the high quality existing studies and they summarize them to form a conclusion. And so this was over 100,000 participants, and they looked to see people who take beta carotene, which is the active ingredient of vitamin A, and they found that there was this harmful relationship between taking vitamin A and cancer in people who smoke. And now you're going to see this chart. I'm sorry that this is maybe a little scientific, but I thought it's important to show. This is called the forest plot. And this again summarizes all the different studies that exist, but high quality studies, randomized controlled trials. You can see on the bottom here, it says favors treatment, which is the vitamin, and here it says favors control. And you could see that this diamond is aiming towards the control, meaning it's better not to take this vitamin. And this was another Cochrane review article from 2010, where it showed that antioxidants, meaning vitamin E, vitamin A, and beta carotene, caused a very slight increase in mortality. And I just like to point out that you can get vitamin A very safely from foods. So if you look at things like sweet potatoes and pumpkins, carrots, you can very easily fulfill your needs for vitamin A just through your diet. So we're going to switch now to vitamin E. So vitamin E, we think of to prevent cancers, to prevent dementia. Again, it's an antioxidant. And this was a very important trial, actually. This was a randomized control trial, right? So they were blinded, and they had 35,000 men, and they divided them into 4 groups. One group took selenium, one group took vitamin E, one group took both, and one group took placebo, and they didn't know what they were taking, right? So this was a blinded randomized control study. And this is what they found. So patients who took vitamin E had a 17% increase in prostate cancer after 7 years compared to those who didn't. And in every scenario, really not taking the supplement was better than taking the supplement. And so this study really concluded against the use of vitamin E for preventing cancer. Now, what about antioxidants in dementia? Obviously, dementia is something that's highly prevalent and concerning for many, right? After the age of 85, 1 in 3 will have dementia, and people have tried many different things to slow down dementia, prevent dementia, and really antioxidants have not played out in terms of preventing or slowing down dementia. So this is the U.S. Preventative Services Task Force. This is a task force that's that works under the government, and they come up with these recommendations, like what should people be doing. So they concluded that the current evidence is insufficient to assess the balance of benefits and harms for the use of multivitamins for the prevention of cardiovascular disease or cancer. So they said there's way too many studies showing yes and no. We can't conclude anything. They also concluded the same thing about nutrient supplements in terms of heart and cancer.
I don't have any audio.
And you guys can hear me, or?
We can hear you.
Okay. And they actually recommended against the use of vitamin A and vitamin E for the prevention of cancer and cardiovascular cancer. So against, so that's a recommendation against taking it. So I know we're moving fast. I just want to hit as much as we can and leave time for questions. So we are switching gears now to calcium and vitamin D, which I know is very, very popular, especially for bone health. And so let's discuss those. So vitamin D regulates calcium and bone homeostasis. Low levels of vitamin D have been associated with diabetes, with falls, with cancer, with everything you can imagine. I'm sure you've all heard of vitamin D and have been checked for vitamin D, and this is something that's been extremely popular. But how much vitamin D do we actually need? So the Institute of Medicine in 2011 published these guidelines, and they said that they support the key role of calcium and vitamin D in skeletal health. And we'll talk about the numbers in a second. But they said that there's insufficient evidence to say that we should be taking them for anything else. So not for prevention of cancer, not for autoimmune disorders, not for anything of that sort, except for skeletal health. Okay, did I miss one? No, okay. And now let's talk numbers. So look to your far right, these nanogram Ng per ml. These are the US numbers. The nanomole is what's used in European countries. So we're going to be looking at this, the nanograms per ml. So if you look at what the Institute of Medicine determined to be adequate, it's a level of 20, okay? And just remember this 50 here, because that's the chart I'm going to show you, but that's the European version. But for us, it's this 20. So the Institute of Medicine actually said that levels over 20 were adequate. Now, I don't know about you all, but in my lab, any number below 30 is red, meaning it's out of bounds. And so it's confusing, you know, why is that? And again, the chart they showed was this, and again, this 50 is R20, okay? It showed that below 20, there's definitely a risk for inadequacy, but the more you go above it, also there's some increased risk of problems that may occur. And these are the recommendations that they came up with. So you could see that for most everybody, it's similar. When you go up in age, there's an increase in recommendation for vitamin D to 800 and calcium of about 1200. But there's a lot of confusion because remember this RDA again, the recommended dietary allowance? Well, it assumes no sun exposure, and it assumes so you know, we know that the sun produces vitamin D, and if the recommendations they're giving, the 600 corresponds to this level of 20, which they say is adequate for 97% of the population. Yet all the endocrine societies, and I'm sure a lot of your physicians as well, don't tolerate levels of less than 30, and some even want you up at 50. You know, a lot of the endocrinology societies, if some of you are being treated for osteoporosis or osteopenia, they want these numbers higher. And so subsequent studies have come out, and this again, there's a 2009 study and another NHANES, which is a large population data set that they look at. And what they then said is that that 20 number may be too low for bone health, that there was evidence that if you increase this level, that you may increase the bone density. And so again, they don't really know what to do. They can't put their foot down, and I'll show you their recommendations in a second. But this was again a recent thing that they came up with in 2018. Again, the U.S. Preventative Services Task Force, and they said we do not recommend the use of vitamin D for preventing falls, which is one of the main things that we were using vitamin D for up until that point. So it's not for falls, and it's not for things that don't involve bone health. I'll give you the recommendations for everything after we talk about calcium. So calcium, with and without vitamin D, is again widely used for the treatment and prevention of osteoporosis. And there's been some increasing controversy around calcium. So this was an important study. So this was the Women's Health Initiative, and this was a study, I don't know if y'all read about it previously, but this was about hormone replacement therapy. But what they did is they then reanalyzed it and looked at patients who were taking calcium and vitamin D. And once again, not taking calcium was better than taking calcium. And taking calcium was associated with heart disease, with stroke, and with coronary disease. And I think I'll give you the literature that I've read. The hypothesis is that, I don't know if y'all, I'm sure you've heard of this, plaques in the heart, right? When you talk about heart disease, there are plaques, right, that form and they can get clogged and you have a heart attack or coronary artery disease. Inside those plaques, besides cholesterol and fat, is calcium. Calcium deposits in there, and that's part of the plaque. Now, when you take calcium in your diet, there's a very slow process of absorption, and so there's this constant low level of calcium coming in. But when you take a 500 milligram of calcium, you get this mega influx, and some of the thinking is that that calcium can then go and deposit in these plaques. Again, I'm not saying this is the absolute, fact of everything, but something to consider. And I think it's pretty clear now from the literature that calcium should not be taken on its own, for sure, if it's not with vitamin D. So what does the U.S. Preventative Services Task Force say? Well, they say that they can't recommend for or against screening for vitamin D deficiency. They haven't found enough evidence to support that we should be screening everybody for vitamin D, because of this confusion around the levels and what is needed and what is not. The other thing they recommend is for men and premenopausal women. Again, there is no clear evidence to suggest that vitamin D and calcium should be taken, so they do not recommend it. For postmenopausal women, okay, there is a recommendation for some supplementation. I think the important thing here is to really try to, it really should be person-centered. How much do you get from the diet? Because if you truly are not getting enough from the diet, there may actually be a role for supplementation, but the amount you need may vary depending on, again, what your lifestyle is like, how much sun you get, all these things. And there are actually websites that you can use to calculate these things. So we are switching gears now to the B vitamins, and you can see that there is, a whole range of them. I think the most popular ones are thiamine and folic acid, but you can see that the main thing that B vitamins are used for is for heart health. And this is the homocysteine theory. So homocysteine, you may have heard of, it's it's an oxidant, it's an inflammatory marker. and it's associated with cardiovascular disease. And the B vitamins, especially folic acid, B6 and B12, play a role in the metabolism of homocysteine. So when you have these vitamins, you can get rid of the homocysteine, it gets metabolized. When you don't, the homocysteine levels can increase, and increased homocysteine has been associated with a lot of bad diseases like dementia and osteoporosis. However, again, this is a Cochrane review article. So this review takes all of the high quality literature that exists and combines it into one to form a conclusion. And their conclusion was that there is no evidence to support the use of B complex vitamins for preventing cardiovascular events. So doesn't work in that one for that one. I'll show you a few studies that differ, but now, what about folic acid? I think the most important thing we think of for folic acid is childbearing women who need to supplement folic acid to prevent neural tube defects. But there are a lot of older people also who take folic acid for cancer prevention. So this was again, a systematic review meta-analysis where they took a whole bunch of high quality studies. This was 10 randomized controlled trials. And what they found is that not only does folic acid not decrease the risk of cancer, but it may actually increase it a little bit. And I just want to say for folic acid and childbearing age. So interestingly, in the United States, they do not fortify the food enough. And so in the United States, women should absolutely take folic acid when they're planning on having children and during the early part of pregnancy. In Europe, however, they do supplement enough. And so the danger is actually not as strong there, which is interesting. Okay, so omega-3 fatty acids, and this is sort of our last big thing before we start summarizing. So there are these Greenland Eskimos, and their lifestyle and their diet is based on marine and plant oils. And so their diet is very high in polyunsaturated fatty acids, omega-3 fatty acids. And this population of Eskimos they're just incredibly healthy. They have very low rates of heart disease, of dementia. And so you would think that taking omega-3 fatty acids would, in pill form, would do the same thing. Unfortunately, it's not that easy. So I like to show this because I think it gets at the difference between taking something in from the diet and then supplementing it with pills. So this typical dietary sup doses, this is what we get from our diet. And then omega-3 fatty acids are very important. You can see that it controls heart rate, it lowers triglycerides, it has a heart rate lowering property, blood pressure lowering, and anti-clotting. But you can see that most of the benefit we get from omega is through the diet. When you supplement with the pills, it sort of plateaus. Like there's only so much that omega can do. The only thing it really still increases is the triglyceride lowering, which, specifically, again, this is something you have to discuss with your physician. If the triglycerides are a problem, this may be right for you, but along with the different statins and things. And so again, something to think about. This was a randomized trial looking at 2,500 individuals between the ages of 45 and 80, and it followed them after 5 years. And the idea was to look at how B vitamins and omega can help health. And really what they found is that taking omega-3 supplements in large doses can actually increase the risk of cancer, especially in women. Again, this is one study, a high quality, but one study. And these are more recent trials. So they did, again, a very large review of the literature, and they concluded that omega-3 supplementation does not help with diabetes. They looked at omega-3 supplementation frailty in older adults. That didn't play out. The heart thing is still up for debate. For every positive study you get, there's a negative study. And I think the jury is still out on that one. And I just want to show you some, because I focused really on vitamins and supplements, but I didn't want to forget some of the other good ones that we take. So again, these were large NIH, National Institute of Health, so the highest level of science integrity in the country. They funded a bunch of these studies. And so multivitamins, again, did not play out for prevention of cancer and heart disease. Echinacea did not work to treat colds as much as we wanted to. St. John's wort did not treat major depression. Vitamin E was not helpful in preventing prostate cancer. Glucosamine and chondroitin for arthritis did not play out when you compared it to placebo, and ginkgo biloba did not prevent cognitive decline. And again, these are large, very well done studies. I like this study just because it's very recent. It was a large randomized control trial, again, NIH funded, 25,000 healthy American men and women. They were split into 4 groups. And again, they concluded that neither was helpful in preventing cancer or heart disease. And again, just to highlight that nothing's for free. So this was published in the New England Journal of Medicine, which is now, we're talking about the top medical journal for in the medical world. And that they published this article that was even more extreme than my talk today. But they published data that was pretty mind-boggling. So about 20,000 ER visits were caused from dietary supplements in the United States. And there's resources that you all can look at online, Medline Plus. There's a natural medicines comprehensive database. You know, when I it's not rare that I encounter a patient or a care partner who shows me what they're giving, what they're taking, and sometimes it's really wild stuff. And I've run into some really wild stuff that has caused actual medical issues. But it's always a good idea before you start taking something to just check and make sure that it's safe. So again, I think just to conclude, because maybe I've scared you, hopefully not too much. It wasn't meant for that. It was just meant to sort of give you a new perspective on the pills that we put in our body. So what do we know we need? Well, we know that women, again, childbearing age, definitely need folic acid and iron. We know that infants who are breastfed need vitamin D. And again, postmenopausal women probably need some vitamin D. Besides that, there's really no strong evidence, or really, no evidence to support taking vitamins for other causes. But what I can say is that it's always a better idea to eat healthy than to take a vitamin. So, I think in conclusion, dietary supplement use is very robust. We're not sure of the benefits and possible harm based on some of these studies. Don't forget about the U-shaped curve, right? More is not always better. And a balanced, healthy diet is always better than dietary supplements. And with that, I can end and open it up for questions.
May I? I don't know if I'm supposed to raise my hand or not. My name is Claire Gansfried, okay? And I am the most confused individual that has just listened to this program. I don't know if anyone else is suffering from this confusion or not, but I really enjoyed your presentation. I am taking Bausch and Lomb AREDS 2. It was recommended by the ophthalmologist to prevent macular degeneration of the retina. Should I give that up? I am also taking Centrum Silver for women 50 plus. That's not an admission of my age, please, okay? And I'm taking a calcium pill. So I do take those every day. Shall I continue?
So I don't think that I'm at liberty to,
Right.
to tell you what you should do at this moment without knowing your full history. But I do think that it's wise to discuss this with your primary care doctor and to maybe, read a little bit more about it. In those Centrum pills, there are a lot of different supplements, right? If the point is to get vitamin D, maybe it's better just to take the vitamin D. I don't know you or your diet or your lifestyle, but I imagine that you eat very healthy based on how your energy and and so, if you eat a healthy, balanced diet, your risk of deficiency of 99% of what's in that multivitamin is very low. And so, again, I'm not going to be telling anybody what to take or not take today, because I don't know you on that level, and I don't want to step on any feet of your physicians, who I'm sure are wonderful. So again, this was something to think about and something for you to discuss with your physician, and based on the diet and based on what's absolutely needed.
Thank you. Yes, I think you're absolutely right. Thank you so much. Yes.
Yeah. I have a question about the company. What companies are good or not good? There's so many different companies, and I'm told that some of them are really not great and some are really good. So could you tell us?
Yeah, so like I mentioned in the beginning, the dietary supplement industry, including vitamins, are not regulated by the FDA. So the problem is, and there was a lot of controversy recently, Walmart and Target, they had to pull from the shelves all these vitamins because what they wrote is in the pills actually wasn't the right amounts, and there was some traces of this and traces of that. And so it's very poorly regulated. I can't tell you specifically which ones are good or not. You have to trust the brand. I think the bigger brands may be safer, and some of the more solid things, the less ingredients in something, I think always the better. But again, none of them are regulated. So nobody actually checks what's in these pills. They do random checks sometimes, but when you take something, even something like melatonin, which I actually give patients in the hospital to prevent delirium, but even something like melatonin, you don't actually know how much ramelteon, which is the active ingredient, is in it, because it's not regulated, which I think is the main point here, is that we don't know for sure if what they're writing is the truth. We hope that it is, right? But we don't know.
Wow. Okay. Thank you.
Doctor, can I ask you specifically about coenzyme Q10?
Oh, so you asked a question after him, okay.
What do I have to hit?
So again, coenzyme Q10, the problem is that there are no high quality studies in a lot of these supplements. That goes along the lines of the B vitamins, and again, there's no strong evidence supporting its use. Again, I don't want to say that for you specifically it's not good. I don't know what's been found or what condition is being treated for, but there is no the U.S. Preventive Task Force has not said that we should be taking it for anything specific, right? And so again, it's based on the physician's experience and some smaller studies. I think one of the new things, the new fads I've seen is magnesium. There's like a lot of talk about magnesium now. I don't know if you all have seen that. I just did an interview about it a few weeks ago. Everybody's taking magnesium now and everybody's deficient. And, the interesting thing about magnesium is that less than 1% of it is actually measured in the blood. Everything else is sort of in your cells, and so you actually don't really know if it's being measured accurately, and with vitamin D also, there's been a lot of talk about that. So, we have to sometimes take these things with a grain of salt when you read them. Again, if something was magical or really worked, there would be recommendations to do it, right?
I have a question. Hello?
Yes.
Yes, you had mentioned something about the fish oil and possibly causing cancer. What level of omega-3s was in that when they did the study? And what was the ratio of the EPA to the DHA when they did the studies?
All excellent questions. The doses were like standard doses, like they weren't giving them mega doses. This was like the standard doses that they recommend on the bottle. I don't know the ratio of that, but I can look into it, and I can of course send you that study.
So was it high dosage? Was it the amount like you would have like in Lavazza, where it's
Yeah, like it was a Lovaza type of pill.
because Lavazza is very, very high. Also, Lavazza has a mineral oil, which has also been associated with arrhythmias, and that's why they
Mhm.
decided not to use that. And I'm wondering as to, with the study that you mentioned, I was wondering as to how many, milligrams of vitamin, EPA to DHA and the omega-3s that were in that when they discussed the increased risk for cancers and what kind of cancers. And
So this was mainly ovarian. That
cancer.
was, yeah, but I can absolutely look at the study in more detail and let you know.
Okay,
I don't know the doses on the top at the top of my head.
because there's so many studies out there
I know.
dealing with the fish oils and the beneficial effects that it does have. So, and what were the controls of that? That would be interesting to know, because if you have all these studies that are suggesting it depending upon the diagnosis, and then you have one study. So is that so-called a legitimate study? That's something that, and how long was that study done for? So these are questions that I don't know, who did that study and how long, if there's been many studies like that out, or was it just one study that they actually did?
So I was doing a literature review before this talk, specifically on omega, because I know that is really one of the most popular supplements right now. And for every positive study, there's a negative study.
Right.
So I think the jury is still out. Like I don't think anybody can tell you for sure that this is the best thing to do or that this is a terrible thing to do. The high quality studies and some of these meta-analyses have not been as positive as you would hope. There are some studies involving heart health that have been positive, but again, I just looked at this literature because I was wondering, what's out there recently, and there's just as many positive studies as negative studies, and so I don't think that anybody knows for sure what is the right thing to do.
Would you be able to send that study to me?
Of course, yeah.
Sure. Thank you. Do you have my email address?
Well, I'll send it maybe to Milton, and he can forward it, or.
Okay, thank you. I appreciate it.
What temple are you from? Did I know? What group are you from?
Me?
Yes, Gwen.
Actually, my brother goes to the temple, and he told me about you.
Which temple?
I'm not. It's somewhere in Woodmere.
Okay.
I'm not
I-
sure.
Maybe
when you
just
get
write your email in the chat, and then we can we
do
can
it
get
that
it
way.
that way.
I'll
Okay,
do that.
thank you. I appreciate that.
Are there any more questions? Go ahead.
I have a question. Your comment about D seems that it might be a good idea to maintain at our age. And what's the difference between D2 that a doctor would give you before surgery at 1.25 milligrams, which you take once a week, and a D3, which you'd be taking daily?
You know, the weekly dosing is just a much higher dosing. It has a longer half-life. And so it's just you get more of it. I think that, you know, there's definitely been evidence that the high dose vitamin D, like the 50,000, that one is probably not the best to use. The difference between the D2 and the D3, I haven't seen studies sort of say like this is better than this. I think most people prefer the daily one, but again, I haven't seen anything to say that one is better than the other. It's just a matter of the half-life and how it gets metabolized.
Can you
And so
comment on
that 20
flaxseed and chia seeds, please?
Can I just finish one thing?
Yeah.
The 20 that you had said that 20 is for D seems to be the border. But doctors have somehow doubled the daily dose for people who are a little less than 20. Is there a problem with that?
Well, again, so the Institute of Medicine, right, which is a legitimate, obviously, part of science, you know, they define adequacy as 20. In every lab that I know, adequacy is 30 at least, but most physicians want, you know, way more than that. You know, if you go to an endocrinologist, they want 50. Again, at the end of the day, the U.S. Services Preventive Task Force said there's no evidence to support going to that dose, but they can't say for sure, you know, that it's wrong, right? There's just not enough evidence to say what we should be doing. It seems that higher levels are better for bone health. So I think, again, it's very individualistic. Like if you're taking it for bone health, I think that vitamin D is probably a good supplement to take if you're postmenopausal. Depending on, again, how much sun you get, how much you get from the diet, I think I would be less inclined to recommend very high doses of calcium. But again, it really depends on the diet. Like if the person is getting a good amount of calcium, you know, the calcium that you get with, you know, in those D calcium supplements is probably enough versus taking an extra calcium. But again, I think it's very individualistic as to how much you're getting from the diet.
Let's say you have almond milk and they give you, they say 32% in 1 cup for your of calcium. Isn't that considered a supplement? Or is it considered
No,
calcium?
it's not considered a supplement. That's when you take something in from the diet, the absorption is very different.
Okay.
Can you comment on flaxseed and chia seeds, please?
I cannot. I have not read the literature on that. I think, again, those are more foods, right? Than again, and I'm, you know, I specifically did not tackle, you know, botanical and Chinese medicine and all these, you know, herbal things that people take. You know, my focus was on the vitamins and supplements, but you know, I think that when you go and read the literature, right, when you Google something, you have to be careful as to who is publishing and for what reason, right? So when you look at social media or, like, you know, mainstream media, they go for the fireworks, right? And so it's a little sensational and may not accurately represent what you're reading. But when you go to resources, you know, like the NIH, the National Institute of Health, like the FDA, you know, things that are legitimate, then you can get, I think, a more balanced perspective as to what the evidence is. Like the NIH has great information on dietary supplements and vitamins. They really break down the studies for you, and they break down the recommendations.
Thank you.
Would you be willing to put your email on chat so people who want to ask questions can do so?
Sure.
Okay, Dr. Sinvani, there are a few hands raised if you want to just look at them.
Can I go back?
Yeah.
Go ahead.
Hi,
Ronnie.
can I go back to CoQ10? So
My
when I
question.
was started taking Flavicol, or the generic, my doctor, my endocrinologist said that it does deplete at some level CoQ10, and therefore he recommended CoQ10, and he does not recommend supplements. So I would like to hear what you have to say about that when one is taking a cholesterol pill.
A statin. Yeah,
Thank you.
again, so for
Ah.
example, my
Brilliant.
grandmother takes a statin and has a lot of like muscle cramping and stuff. So I told her to drink some tonic water, which is high in some of these electrolytes, and that really helps her. So yeah, I think, I'm not I'm a geriatrician, I'm an internist, I'm not a cardiologist. And so the level of detail in terms of statins and recommendations like that, I cannot make, and I, won't go against something that's told to you. I think, again, it depends on the reason, and it depends on your diet and what you're taking. I think that if it's something that's worked for you, I wouldn't necessarily stop it. I think that if it's something that has worked for you and has not caused much downside, again, it's something you can revisit. But otherwise, I think, again, diet is always better than pills. That's for sure. So anything we can get from the diet is better than taking in a pill form.
All right, just to jump in, I had the same question that Ronnie had, because I'm also on a statin and I was also advised to take CoQ10 for the same reason.
Yeah, again, there is no study that says that people who take CoQ10 with statin do better than not, right? I think that this is a lot of experience from the cardiologist and what they've seen. They found that it's helpful. I think if this is something you've been doing for a while and it's worked, I don't think there is any reason to all of a sudden stop. But if you want to have a conversation with the cardiologist, is there something I could eat or drink that is equal to that? You could always do that. But again, I wouldn't stop something that a physician recommended, right? Like the things that I'm trying to say to you is, when you think you want to, live a healthier lifestyle, don't go to the vitamin shop and load up on vitamins. That's different than if a physician recommends a certain supplement, right? That person has said it for a reason. And so that's different, right? That's different than deciding that you want to now take a lot of vitamin B for, to prevent heart disease.
Microwavable dish if you want.
I have a general question. It seems like all these vitamin and supplements that you talked about have several effects beyond what you're taking them for. When I go to the doctor and he takes blood and he reads and he'll say, you're low on vitamin D and take the vitamin D. But I don't know if the other side effects are worse than fixing the vitamin D. So.
Yeah, I think, vitamin D is something that we measure, and there's actually been a lot of controversy about the measurement of vitamin D. You can get very different levels depending on where it's measured, and it's very hard to sort of standardize the numbers. And how is it that the whole world is vitamin D deficient all of a sudden? I mean, there's a lot of questions to be asked. I think vitamin D specifically, for bone health is important. And so if you have osteopenia or osteoporosis, or your risk for fractures, then vitamin D may be very important for you. And so again, I think it's a very individualized process, and something you have to sort of discuss with your physician.
And like you say, the natural thing is better. I spend a lot of time in the sun, enormous time, and yet the vitamin D shows deficiency.
Yeah. Yeah, I mean, I think everybody is deficient in vitamin D at one point or another, but I think also, we have to define what deficient is and how much you're getting from the diet. And yes, vitamin D is complicated.
Okay, thank you.
Okay, we'll have time for 2 more questions.
Yeah, I have a question, please. Obviously, it seems that it would be a really significant, great idea if these dietary supplements could be monitored, et cetera. Is there anything on the horizon that may be happening? And if not, how can the general public push it along?
Yeah, so this is the power of lobbyists. Every time the FDA has tried to incorporate legislation to prohibit and to sort of give more mandatory guidelines to this industry, it's been struck down by lobbyists in Washington. And so I don't know specifically how as the general public. I know that what I've taken on is giving these kinds of talks and just making people aware that, again, I differentiate between a physician who makes a recommendation for a specific supplement to us going to a store and buying a whole bunch of vitamins because we think we need it or we're deficient or something like that, right? And so I think that we just have to get the word out, and if I do find an avenue, I will let you know. But I don't know it for sure what we could do as the public now.
Okay, 1 more question?
Thank you.
No?
Paul
Okay,
Paul Goldberg, I think, is raising his hand. Pauline,
Goldberg? Okay.
I think
Did
you're
you put
muted.
your email, in the chat?
Not yet.
Dr. Simon, okay. So I'm good. We're going to conclude it. Steve, you want to say something?
Yeah,
Steve?
Stu, did you have some? Your hand is raised.
Just a quick question. When I go to the drugstore, there are dozens of brands of multiple vitamins. How do I judge? Is there a way to judge which multiple vitamin I should take, which brand? Or I usually go for whatever's on sale. But is there a major difference between different brands of multiple vitamins?
So you have to read the ingredients. Multivitamins, like I said, have 30 different supplements in them.
Right.
The question is, do you even need that multivitamin, right? I've shown you many studies that question that. Is it for vitamin D? Well, then just take the vitamin D. Is it, what are you trying to get from that multivitamin? That's the first question, because different kinds have different compositions. And in terms of what brand, again, this is not regulated, and so we don't know. I think probably the trusted ones are the bigger ones that produce a lot of quantity, but I can't tell you that. Nobody knows because we don't actually know what's in the pills, right? So it's hard to answer that question.
Okay, thank you.
Anyone else at this point? Okay, then we're going to conclude. I want to thank Dr. Liron Sinvani for her informative and very comprehensive and interesting presentation on vitamins and dietary supplements. I believe that we're all now more knowledgeable about what is good for our bodies and that additional investigation may be necessary before taking any vitamins or supplements. I also want to thank Steve Sloff for assisting with technical issues, our chief technical advisor. And I also want to thank our Temple Bethel leaders and the executive board of the Men's Club for their support. Lastly, I want to thank all the point people from the 5 other synagogues and the JCC for their help in making this event a success. Stay well, stay safe, stay warm. Have a nice day.
And thank you, Milt.
Excellent program.
Thank you. You're welcome. Yeah, okay.